The first cases of this new kind of coronavirus were publicly reported in late December in China. Since then, it has taken weeks for officials to get data on how fast it spreads and who is most vulnerable. Tom Frieden, former director of the Centers for Disease Control and Prevention, says they are still figuring out the basics.
So far, it's clear that in terms of infectiousness, it can go from person to person, but we don't know whether that requires a lot of contact or a little contact, and that makes a big difference. In terms of how deadly it is, we know that it's commonly causing pneumonia and that it can cause severe disease or death, but we don't have a sense of whether there are lots of people who have the infection without any symptoms. So there's a lot we don't know.
17 years ago, China struggled to contain the virus that causes SARS and was heavily criticized for withholding critical information. Now, many, including the World Health Organization, say China has improved. They cite China's rapid sharing of the virus's genome sequence, allowing for quick testing.
There are some areas which have shown dramatic improvement in professionalism and transparency, and there have been other areas that have been delinquent, that have been very costly. On the latter, when the cases first appeared in Wuhan, in Hubei province, in December, there was a lag of a couple of weeks of reporting.
But the continuing lack of independent news media coverage in the authoritarian country means that even now there remain questions about how severe the situation is in China.
You probably have noticed that there were like 15 healthcare workers being infected in Wuhan. Well, that is very important because it is an indication, right, of how serious, how dangerous the virus is, because the healthcare workers usually are not that easily to be infected. But they only reported that after January 20th.
Even inside the country, Chinese officials have been publicly criticized for a sluggish response.
We hope people can understand that the information disclosure has not been timely. When it comes to infectious diseases, we have the Infectious Disease Prevention and Treatment Law, which requires information to be disclosed in accordance with the law. As a local government, we need to get authorization before disclosure.
On Tuesday, the U.S. Health and Human Services Secretary publicly pressed Beijing to open up and allow more public health experts into the country to assist.
But getting WHO, CDC experts on the ground to be able to assist the Chinese experts. In addition, as Dr. Fauci mentioned, the more actual isolates that we can get, actual live isolates we can get, the more robust we can ensure any therapeutics or vaccines would be, more targeted and on top of the genetic sequences that has been shared.
The CDC recommends that all travelers avoid all non-essential travel to all of China in response to the outbreak. Mariama Diallo, VOA News, Washington.